There you are.
Okay, finally.
It's okay. We finished the question that I had about the device. So I think we talked about this, Dr. Lal, earlier, like this week. Lily Lewis has a question about birthmarks and freckles and moles. So these two ladies, Lily Lewis and Elizabeth Bernice Hillhouse Carter, that was a mouthful. They want to know if you can use diode laser on light birthmarks. Light birthmarks, are those okay?
So I would say any type of pigmented lesion, you know, I will tell you, even in the office, sometimes we do biopsies if we're concerned about certain spots,
Okay.
because we never know what something is.
Okay.
So unless you see a dermatologist and they tell you that the spots are benign and they're safe and they're not dangerous and they're not moles, we don't like lasering moles because we don't know if the heat changes the mole cells. You know, we don't want that to happen because moles can become melanoma, which is a skin cancer.
Okay. Okay.
I think it's fine for age spots, like those mottly brown pigmentation that you get with aging. It's probably okay. And if you notice that with treatment they're not going away, that may be a signal to see a dermatologist to get a biopsy. But I would say I would not do anything without the supervision of your dermatologist. And if they say it's okay, then I think it's completely okay.
Okay, that's really good info. I remember you were saying, you know, how you get that, like, that hair that comes out of the mole. Don't do it. Don't laser it at home. Go to your doctor, your dermatologist.
Don't do it.
Yeah, don't do it. Is it okay to pluck those hairs?
Yes,
okay.
It's completely okay to pluck.
Okay.
100% okay to pluck them.
Okay, just wanted, I have one of those and I pluck it often. So, well, thank you guys for that question. I remember our last live that we did, we talked about freckles. I have freckles. You said it was totally okay to do it right over my freckles. So yes, Elizabeth,
absolutely.
Go ahead and treat with the laser over the freckles. It should be totally fine. Okay. So Leah Dercole Craig says, this is so cute. Will the 4X work on those pesky black hairs that magically show up on my chin and my neck? Yes. I mean, yes, you can definitely do the black hairs. Black hairs are the best, right? Is there a reason why the black hairs are better than, let's say, the red hairs on the skin?
Yeah. So, you know, red and blonde hair have a different type of melanin called eumelanin.
Okay.
Now, this melanin is not a strong enough chromophore for the laser to target. You need dark melanin, which is eumelanin, and that eumelanin is found in brown and black and darkly pigmented hairs. So the pheomelanin in blonde and red hairs does not get picked up by the laser beam, and so that's why people who are red or blonde don't respond as well to laser hair removal.
Okay. A lot of people had that question today, so hopefully we covered that. Leah also wanted to know, and this is something for me to answer, what's the average amount of treatments to do to see results? So I talked to a lot of customers to get their input on this, and they say it takes about 3 to 6 treatments. So that would be, let's say, a month and a half to about 3 months, but it could take up to 6 months worth of treatments to see total results. It depends. Everybody's different as far as treatment, you know, how many treatments you'd have to do. So you have to do 1 treatment every 2 weeks with our device, this one here, just to make sure everyone knows, and this one here, both the same. So it varies. And is there a reason why it takes some people like 2 sessions to see hair loss, and compare that to people that take 6 months? Is there any type of reason why that happens?
Yeah. So, you know, hair goes through a number of different cycles. There's an anagen phase, which is the growing phase, the telogen phase, which is the resting phase, and then catagen, which is when the hair breaks down and is being degraded before it can renew. So everyone has a different anagen phase of the hair. Some people have very long anagen phases, and that means they can have very long hair. Some people have shorter anagen phases. So depending on how long your growth phase is going to dictate how many treatments you're going to need. Usually I say the thicker the hair you have, the longer the hair you have, the longer it's going to take.
Okay.
The finer and the thinner the hair you have, probably the shorter it's going to take to get the results that you want.
That's a really good answer. That's very good information. I also wanted to point out Marilyn Berry and Ty Marie Wynea also had that same question. How many sessions? And yes, I didn't know actually that, well, I don't know the answer to this question. Kathleen Laughlin wants to know if the texture of the hair makes a difference. So I never even thought about this. So can you tell me if the texture would be like the thickness?
Yeah.
Or maybe if people have like, I don't know, some type of texture, would that make a difference?
So in theory, no, because the laser targets pigments, irrespective of what the texture of your hair is, whether it's more kinky hair, more fine hair, it just depends how much pigment your hair has. So the color of your hair is what matters the most for laser hair removal and achieving the best.
Okay, that makes sense. Okay, so that is answered. So a woman named Kimia Nami, she wants to know how many pulses it would take to do your face. This is something I could answer. So for me, I have PCOS. I will have to tell you, I keep getting new hair growth as the years go on. It starts to grow. It started from here and now it's like going up. It's like growing up this way. So for me, since I have such a large area, it could take me, I don't know, 100 pulses, 200 pulses to do my whole face. But for somebody that just has like a little patch, it could just take maybe like 20 pulses. So it depends on how many hairs, I guess, per square inch that you'd be treating would be how many pulses you would need. So everybody would be different here. What you can do is treat the area. Our 4X only has the LED screen, okay? So it'll tell you how many pulses you use. You can write it down and kind of guess, you know, how many pulses your machine will last, because you get 90,000 pulses per machine. You can kind of, you know, see how far along you will get with this machine alone. 90,000 pulses is a lot, so you'll be fine for a while, for a couple of years. So yeah, when you do laser hair removal in the office, Dr. Law, do you have like a pulse counter and then you tell that person how many pulses they had, or how does that work?
So yeah, so typically the device does have a pulse counter, and we document the number of pulses in their chart. And usually the more treatments that you continue to do, the less pulses you're going to need, because you're going to have less hair,
right.
and much more finer hair. And so the number of pulses is not going to remain the same. If you start out with 100 pulses for your face, you might only need to do maybe 10 or 20 when you're completely hairless or happy to maintain those results.
Yep, that makes total sense. Aaron, hey Aaron, with the heat of the 4X, I'm a type 5. I guess that's skin tone. Should I be on a power level 5 always? So, you know, what I always hear from customers is that level 5 will get you your results quicker. The higher you go, the more snap that you feel, the better it is. What do you think about that, Dr. Lowe?
I think you need to do. So the thing is, remember, if your skin is darker, your skin acts as a competitor. Your skin color acts as a competitor for the hair. So it's better to go low and go slow.
Okay.
So you want to be able to make sure that the treatment is comfortable for you. So find the setting where you're comfortable, not in pain. You know, it should be slightly uncomfortable, but it shouldn't be super painful. And maybe do a test spot, and keep checking that area to make sure you're not getting any paradoxical dark spots or hyperpigmentation. or scarring, which is scarring is unlikely, but definitely you can get dark spots in areas if you're over treating with a high energy and you have darker skin.
Okay, low and slow, Aaron. Go on like maybe a level 3 and
Yep.
yeah, once every 2 weeks and see how that goes. Oh, Aaron, I'm sorry. He said it's so painful. Yeah, try a 3. You don't have to go all the way to level 5 like Dr. Law said. Try a 3. You should still see results no matter what level you're on. It just might take a little longer to get there. So Aaron, you're okay. You can turn it down, honey. I know Aaron had a question too. I'm going to get to that in a little bit. So let's see. So Fatima, she's one of our biggest fans. She said, at what age can you start doing laser hair removal? Well, for our company, for Tria, we only have a clearance to sell to women and men 18 and up. So we're FDA cleared for ages 18 and up. But Dr. Lal, I know you were saying that you, a couple weekends out of the month, help treat children that have issues with hair.
Yep.
So how young can they do it at the clinic? Can you tell us a little bit about what you do?
In theory, I typically don't treat anybody before puberty. You can treat a child at any age with laser hair removal.
Okay.
It is safe. The problem is teenagers don't really start getting that thick hair, which is what we call terminal hair, until they hit puberty when their hormones change.
Okay.
And for some people, based on their ethnicity, they may have a thicker and more a broader hair pattern. So, you know, some people are more hairier than others based on their ethnicities. So I treat a lot of people, especially for unibrows starting at age 12, 13. I've treated as young as 10 for excessive facial hair in Indian, Middle Eastern, and Indian and Middle Eastern females. And then I also treat certain hairy birthmarks, the laser hair removal device, earlier, because that hair can kind of transition into that thicker hair at an earlier age. But I think it's as long as it's comfortable for the patient, it's safe, and it's done in a controlled manner, and the indication is good.
Okay. Yeah. When I was younger, I had a unibrow, and my mom held me down on the bed and would pluck it, and I would be screaming my head off. So I totally understand what that's like. My legs were very hairy, and so I had to wear nylons when I was 9. So I totally understand about that childhood embarrassment that you can go through when kids start to say
Absolutely.
Yeah. So it can be done. So here's the answer. So for Tria, if you want to use Tria, you have to be 18 and over. But there's certain clinics like Dr. Lal, he can help treat children that have that, I guess you'd call it that dark peach fuzzy hair, prepubescent peach fuzzy dark hair. But yeah, if anybody needs his contact info, DM me and I will get you in touch with him if you're in the New Jersey area. Because if I was in New Jersey, I'd be in his office right now. So I'd be there now. I'm totally across the other side of the United States, unfortunately. Yeah, so Faith Alexis has a really good question. She says, there's so many hair removal lasers out there on the market. And what's the difference between all those ones that I'm seeing on YouTube and on TikTok and all that stuff? What's the difference between Tria and those other ones? And I did, let her know those are IPL devices that she's seeing. If it doesn't look like this and doesn't say Tria, it's IPL. So can we just give her a quick, tips on, or quick facts on IPL versus laser? Just some quick little facts, because we have a lot of that information already. But
yeah. So IPL is called intense pulse light. This is a device that uses light-based energy, not laser energy, because it's not a beam, a laser beam that is directed at a specific target. So this is using light-based energy, and light, different filters of visible light are used for certain effects. And so IPL is used to treat redness, brown spots, hair removal.
Yeah.
And because it can treat so many things, I often call it the master of none, because it doesn't really specifically target the same things
Yeah.
as a laser does, because it doesn't have, it's a very non-specific device, and you have to be very careful. IPL can absolutely not be used in people such as my skin color, and I'm a relatively fair-skinned dark person. Like I would say I'm a skin type 3-4. And I'm not a good candidate for IPL. Really, people like you or people who are extremely fair, skin types 1 and 2 benefit most without the risk of side effects with IPL devices. They often also take longer because they're not continuous laser beams than laser devices.
Yeah.
So there are certain differences that you need to be aware of.
Okay. Yes. And those are very good distinguishing features between IPL and laser. Laser, if you see the window here, it's very tiny. I'll show you kind of like my fingernail. It's as big as my pointer fingernail. That's how small it is, but it's being precise. It's targeting hairs individually, but IPL is like that, like a fan. It's like this big burst of light, and it's kind of scattered. So you want faster results, you do the laser for sure. So that was a great question. We also have a blog post about this. We have lots of YouTube videos about this, so definitely take a look. If you see any ads saying it's laser and it's something with a cord hanging out of it and they have their sunglasses on, their protective glasses to wear that you have to wear when you use IPL, you're like plugged into the wall and you have glasses on, it looks crazy. That's an IPL machine, most likely. Like almost 99% that's going to be an IPL device, and they market it as saying it's a laser when it's not that technology. So Fatima's asking, so IPL will not work on medium skin tones? Fatima, I'm trying to think. Medium, I say that our device will work on light tan, but anything over light tan, you can get injured. Remember what we were talking about? It might make, it's competing with your hair color. So if your hair color and your skin tone are the same, then you're going to possibly get some type of injury or burn. So medium skin tone. Dr. Law, what would you say a medium skin tone would be? Would it be like your skin tone or a little bit darker? What's medium?
Yeah, I think for me, medium, like the Indian, Middle Eastern, typically skin tones do respond with this laser. So I think that that's okay. Anything, anything more than that, for example, black skin, I would just be wary and careful, because we want to use the way we target those lasers in our clinic is we're able to adjust the pulse duration, and we can't do that on this device to make sure that the laser penetrates for a long period of time to avoid injury to the surrounding skin. So I would just say, if you have black skin, you probably should be seen by a dermatologist, not a laser med spa or center where they do not have a dermatologist, because that one of the major causes of concern and the major causes of lawsuits in aesthetics is actually hyperpigmentation and skin changes. And often these come from IPL and laser hair devices that are done by people that are not trained. So don't get the Groupon and go to the, Nancy Drew. You want to go to a dermatologist. Spend your money wisely. It's worth going to a medical professional who is going to make sure that you get the outcome that you want, minimize those side effects.
Right. Agreed. We do have a skin tone chart on triabeauty.com. But if you're unsure, please do not buy our device and take any chances on that. You definitely want to go to a dermatologist, board certified. Dr. Law's double board certified. Okay. So he knows what he's talking about. Don't, like you said, don't get the Groupon. I've gotten Groupons and have been not for laser, but for other things. And I'm like, does this person know what they're doing at all? Just because there's a pretty office that you walk into and they're wearing a white lab coat does not mean you're going to get a professional result. You might get injured because you do have to sign your life away when you're getting these procedures done that you won't sue. So you have to be really careful. So yeah, call the dermatologist.
Absolutely.
Yeah, go ahead.
Yeah.
Go ahead.
And like I said, there's a lot in my office, and they say, like, I want to do laser hair removal. I don't think I can necessarily afford it. Do you have any other options? And that's when I recommend to a lot of people, your skin type would qualify as a great would be great for the Tria device, so use it. Or I would tell them, no, it's not good for the Tria device, and you're better up saving and getting an office treatment. So,
Right.
your dermatologist is not going to, there's an ethical obligation to being a physician, that it's you that matter, right? Business is, neither here nor there. We have to make sure that we do what's safe for you, because if you suffer, we suffer. So,
Mm-hmm.
don't think that by going to a dermatologist, they're going to be seeking your money and will tell you, oh, don't get the device, but the at-home device, because they're not that strong. I do not know any dermatologist that would say that, especially if it wasn't if it wasn't the truth. So I think you definitely need to make sure that you make the right decision.
Yeah. Yeah, be smart about it. Don't just get the Groupon because it looks like a good price. You get what you pay for. Whew, let me tell you, I've had so many bad things on Groupon happen to me. Let's see. We already went over skin tones. Okay, Aaron does have a question. Aaron, who we talked to earlier, he's asking if Tria is coming out with a numbing cream. No, not as far as I know. We're not coming out with a numbing cream, but he has this. I know Aaron has the cooling gel. He says it's not helping him. It's not cooling enough. Remember, Aaron's using level 5. So we told Aaron, dial back to 3 or 2, low and slow. And keep using the cooling gel. It has aloe vera, kind of keeps your skin cool as you're treating. It's a good after treatment, like a post treatment, because it cools down the skin and it kind of calms down like any redness. But Dr. Law, remember we were talking about lidocaine gel? Some people say lidocaine gel works really well over the counter for, using it right before laser. But remember we were talking about how deep the laser does go and how sometimes lidocaine gel doesn't do anything or help. So what would you recommend for
Yeah.
Tria users to try out?
So typically, laser hair removal does hurt because the hair is in the fat, so it's kind of deep.
Yeah.
I highly recommend getting a lidocaine cream, not a gel.
Cream.
You can get one that's called LMX. LMX is a liposomal, I think it's like a 4.5% or 4.4% lidocaine, that is over the counter, and you can use it. You want to apply a thick dollop, and cover it with saran wrap and have it on for an hour, and then wipe it off and treat the area. It will help.
Okay. Aaron, I hope that helps. Okay. Try it out and get back to me and let me know how that goes so I can tell other people how your experience was. He ended up buying something from Germany and he said it's no good. So we have a couple more questions. We're almost done. Carrie McCafferty asked, is there a skincare routine that you can recommend for pre or post laser care? She's really sensitive. Is there something she could put on before or after the treatment to kind of calm her skin down, besides, of course, our aloe vera? But is there anything else that she can do?
Yeah, I think when people are concerned about having discomfort after, cooling agents like ice immediately after the treatment can be helpful. So icing the skin for a few minutes, getting get a cube of ice, put in a Glad bag, and just rub the area. That can be very helpful. Another thing you can get is a over-the-counter cortisone cream. And you can apply that if you have itching or, you know, a burning sensation or some irritation after treatment. Use that for a day or two, and that should calm things down also. In terms of pre-treatment, I really don't like people to use anything other than the lidocaine cream because or that gel, because I don't want it to interfere with the treatment. So I would wait until after the treatment. I mean, like I said, if it's painful, you should dial down a little. The goal is to be uncomfortable but not painful. It should feel like a wowza, not a oh my gosh. I don't think I like it hurts.
Yeah, I don't think I've ever had a wowza on a level 5 even. And I'm really sensitive. I'm a baby when it comes to this kind of stuff. So I can do 5 on certain body parts, but other body parts I'm a 2, 3. But now that you're saying low and slow, I'm going to take that advice and do that. It's better for me because my skin's very fair. I do get the redness. So there you go, Carrie. I hope that answered your question. I'm going to actually switch gears and start talking. I have one question. This is my kind of my own thing about this. So now you're familiar with this beautiful lavender SmoothBeauty laser. We have a new skincare line. I have it in my hands right here. So this is the Radiance Collection. This is brand new. We just got this around Christmas time. So what this is going to do, and maybe you'll help me, for people that can't access this Radiance Collection stuff, maybe we can talk about, okay, this here is the cleanser. So cleansing is very important before using this because you want a clean surface. Now, a lot of people ask me why there's no conductive gel used with fractional laser. Well, let's tell them why there should not be anything on the skin when they're using this, because I get a lot of those questions.
So it depends. Usually the goal of, a non-ablative laser is to use heat to coagulate the skin.
Okay.
And it depends on the technology. For a diode laser like this, given the distance that the laser is from the skin, using a gel will not change, will not alter or change the conductance, and may interfere with the penetration of the beam.
Right.
Oftentimes we use gel when we are using a crystal, for example, that's in contact with the skin to glide, provide cooling, and to help as a medium. But the way that the device is made for this device, that is not required.
Yes, and make sure that after you use it, you guys, to wipe it with an alcohol wipe, because if this has like skin oils or something on it, dirt, it's going to block the beam, and then you're not going to really get results. Okay, so you got to make sure you keep things clean, especially also this too. Wipe it down so you don't block the beam. So we do have a new cleanser. It's unscented. It's wonderful. It gets all the makeup off without stripping the oils, because you definitely don't want to strip your skin, because this is going to dry it out a little bit at the beginning. Can you tell us, actually, I'm also struggling with this question too. So when I use the laser, I get like little flaky pieces like right here and like on my nose. Is there anything you can do after you use the laser while you're using after you do your session? Is there anything I can put on at night so I don't get the flaky stuff on my face? Is there anything you can tell me?
I always tell people the best post care for devices that are, for resurfacing and rejuvenation are petrolatum. So petroleum jelly like Vaseline, because we know that there are healing properties of Vaseline. The skin is trying to, resurface itself. And the only thing that's chemically inert, that's not gonna react with your skin, is something like Vaseline. Aquaphor is okay too. Another good product is a Vanna Cream moisturizing lotion that comes in a pump. All of these things are very natural agents that are chemically inert and are not going to alter your treatment or cause irritation to your skin further.
Okay. I'm actually allergic to Vaseline. I get pimples. Is there anything else that I can, like Aquaphor, is that different from Vaseline, or is it about the same thing?
Aquaphor is very similar. It just has lanolin in it, which is a sheep sebum to it makes it a little softer. So if you're
Okay.
getting that, I would look for a non-comedogenic moisturizer. Vanda Cream is a really good one. It's also very affordable and it comes in a nice big pump. That's one that people often like if they're getting issues with acne or acne-like eruptions after using Vaseline.
Okay. Yeah, so I just wanted to show people the new Primrose Glow moisturizer that we got. So this has a lot of natural botanical ingredients. There's like rose hip oil, there's primrose, and it's pink color just to kind of show. You see that pink? That's all the rose essence in there. I've been using this after my laser, and it gives me a light, kind of what you're talking about. It's kind of a light oil, like an essence. There's not really any fragrance because I know a lot of our customers said I have to have fragrance free and I have to have something that's botanical. So that's why we came up with this. But it's not greasy, but it gives you just like enough moisture to kind of get you through those after treatments. Like how it feels kind of red and hot. It calms it down. It's really cool, and it gives you kind of that sheen. But this is to wear at night and then in the morning. You can wear it twice a day. I love it. It's brand new. You can get it in a set like this, or you can buy individual pieces, or you can get it with the laser as well. So we have different ways to get this stuff, and I know a lot of customers get upset if you can't buy things separately. So we do have it separately now. So check this out. This primrose stuff is really good. I didn't know anything about roses for skincare until like maybe the past year. There's like a huge surge in like primrose, rose oil, that kind of stuff lately. Do you know anything about like what rose and primrose and stuff does for your skin? Is this something you're into?
Yeah, I mean a lot of these oils have a lot of, they're a little bit more elegant. Like you said, they're not as greasy, and they also have anti-inflammatory properties like these bioflavonoids.
Yes.
And they're also not as reactive as some other botanicals, and that's why they're very popularly used.
Okay.
But yeah, so that's what I would say.
Yeah, this is a very light formula, but I think for people that are still struggling, like me with a little peeling, using the fractional laser, do the Aquaphor. I'm going to try that and see what happens. I'm going to do a little Aquaphor magic tonight, and I'll let you know what happens to me. Hopefully I'll wake up glowing.
Yeah.
We are done. Can you believe this? This is such a great day. I'm so excited to do these with you. You have so much information that I think is so valuable to people who are not sure what our lasers are. And there's so much technology behind our machines that we really need to deep dive and help people understand it a little more. And if it can benefit them in any way. So, of course, you are much appreciated, Dr. Law. I love it when you come on and talk to us. I feel like I went to dermatology school.